Hi, Claire here from Rose PT. Today I want to talk about low back issues. The muscle area that we're going to target today specifically is the QL, or the quadratus lumborum. It's this muscle right here. It attaches to the bottom of your rib cage and the top of your hip. You can see it from both the front and the back. You've got one on both sides. Sometimes one can be tight, sometimes both are tight, depending on what your activity is. I want to show you 3 different techniques for getting to the low back, the side of the low back specifically. We're going to do an activity on the foam roller, an activity with the Theracane, and we're going to do a stretch up against the wall. There are a couple of different ways to assess if your back is tight. You can do a back bend and just stretch and see if your back is tight that way. You can do a little bit of a forward bend, see if your back is tight that way. You can also do a side glide. So this is both an exercise and an assessment. So you put your feet about 12 to 18 inches away from the wall, put your shoulder up against the wall and kind of block your rib cage with your forearms. So you're here blocking your rib cage with your forearms. You're then going to drop your hip to the wall. And if you don't feel a stretch, you can bring your feet out even a little further and drop in. This side glide position will allow you to assess if the side is tight or not. Do the same assessment on both sides. Check the other side. See if one is tight. The second way to get to the side of your low back is with the Theracane. You can reach around and get right in there, sort of, going at different angles of your low back. If it's not enough pressure, you can actually lean up against it and put some weight against it, putting some pressure. Try to keep the muscles of your low back relaxed as you do it so that you don't block movement. The third way to get to your low back is with a foam roller. You start in a laying down position, lift your hips like a bridge, roll the foam roller under your low back, rest on the foam roller so that your hips are just relaxed and draping over the foam roller. You can do a couple of different things here. You can do a pelvic tilt where you drop your hips over and arch your back and then bring your hips up and go back and forth a few times. You can also rest in an extended position and rock your knees back and forth very gently. When you're done with the foam roller, lift your hips, push the foam roller down, and that's it. Tightness in the low back is a really common issue for people. People who sit at a desk, triathletes, crossfitters, cyclists are some of the more common ones that we see here in the clinic. And that concludes stretching of your low back. Stretching against the wall using a side glide, using the Theracane, and using the foam roller to stretch.